Okay, so my patient today is going to be Mr. Champion. He unfortunately has an injury to his front arm, shall we say. So we're going to make sure that we have proper BSI on. I would have gloves on if appropriate, and if it were spurting, I would put on eye protection, maybe even a gown if I needed to. We're going to expose the wound, so if he were wearing any sort of clothing, we would make sure that that was away from it. We're going to come up and with our gloved hands, we are going to put a bandage directly onto the wound and hold pressure. If we could, we would elevate the limb or the exposed part so that we could exposed wound, so that way blood flow would stop rushing downwards. It's better if it's up. So if he had hands, we would ask him to assist and to hold pressure onto that bandage while we got, or that pad, we got our bandage ready. Unfortunately, he doesn't have hands, so he's not going to be helpful. He also thinks that he's actually injured right now. So we are going to make sure that we keep pressure on that, make sure that we secure our bandage around once, and we are going to start from the top, work our way down, make sure that we have at least a quarter of the bandage overlapping each time. I'm doing more like half because it's such a small area. Keep going over. Make sure we don't have any huge loose gaps or anything like that. If the wound had continued bleeding past the one pad that we first put on there, we would put additional pads on there before we put this bandage on. Almost at the end here. So we have this end. We have little clips for this bandage which we can use. However, if we didn't have that, I would pull out my medical tape and put 2 pieces of tape over the ends to secure the bandage in place. So then we're going to make sure that we check the distal part of where we have bandaged to ensure that we still have a pulse, because we don't want to cut off any circulation there. And we are going to thank Mr. Champion for how well he did holding on to that.